and welcome to A Sound Constitution, here on CHLY 101.7 FM, a show where we focus on health topics that are important to our community. This year's team is made up of 6 VIU nursing students, and our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, on Instagram at CHLY A Sound Constitution, or email us at asoundconstitution@gmail.com.
We begin today by acknowledging that we are gathered on the unceded and traditional lands of the Nanaimo people, whose rich cultural history continues to inspire and guide us. Our broadcast also extends into the territories of the Coatsan and the Sliaman nations. We are deeply thankful for the Nanaimo people's enduring connection to this land and for the opportunity to live, learn, and work here today. We make this acknowledgement with a commitment to honor and respect Indigenous cultures, traditions, and histories, and to actively participate in the ongoing work of truth and reconciliation. For more information on the ongoing reconciliation work and land acknowledgement practices of the Nanaimo people, we invite you to visit our Facebook, Instagram, and YouTube pages.
Hello, everyone. I'm Finley, and welcome to the show. Today's episode is called Ain't No Harm in Harm Reduction, and it's dedicated to breaking down what harm reduction really means and why it matters here in our community. Today, we're unpacking the facts behind safe consumption sites, the lock zone, drug checking, and safe supply, as well as exploring how these services save lives every day. We'll dive into local supports, the gaps our community still faces, and hear directly from the Harm Reduction Alliance about their work on the ground. Together, we'll challenge stigma, highlight equity, and share some practical tools to help keep people safer. Stay with us as we start off with some definitions and general information to get the ball rolling.
Hello everyone, Sophia here. We'd like to start today's episode by exploring some of the terminology and definitions that surround harm reduction and addiction services. Let's start by talking about the term harm reduction. This term has been used a lot in recent years, especially in the media and politics. But what does it really mean? What are some of the real-world examples? Does it only apply to addiction services? Let's talk about it. The definition of harm reduction by the journal Drug and Alcohol Review, published in 1995, defined the term as an attempt to mitigate the adverse consequences of drug use amongst persons who continue to use drugs. It was developed in a response to the excesses of a zero-tolerance approach. Harm reduction emphasizes practical goals rather than idealized goals. Before we talk about examples of harm reduction in addiction services, let's explore an everyday example. Seatbelts. Seatbelts are an innovation that seek to reduce harm caused by motor vehicle accidents. Driving a car can be inherently dangerous. Lots of things could go wrong while on the road. So, is the solution to stop driving? For some people, it may be a reason enough to not drive. But for most, the solution is to develop strategies and practices that can be taken in everyday life to reduce the potential harm that could be caused in the event of a crash. Wearing a seatbelt won't stop the crash from happening, but it will reduce the potential harm that individuals experience in the event of a crash. Now let's talk a little bit about harm reduction in reference to substance use. Let's use alcohol as an example. In Canada, alcohol is a legal substance that is nationally, provincially, and territorially regulated. Most of the harm reduction practices surrounding alcohol consumption have been socially accepted, like there being a legal drinking age to reduce the alcohol consumption amongst youth and adolescents. This is in place to reduce the harm that alcohol consumption can cause to people who are still developing and growing. Another example is regulating the content of alcohol, like the percentage of liquor and what other ingredients are acceptable to add. For example, in Canada, it is not legal for alcoholic beverages to be produced with added caffeine. Health Canada says this is because individuals consuming alcohol mixed with caffeinated drinks may not feel the effects of intoxication, because caffeine can mask the drowsy effects associated with alcohol use. This puts them at risk for over-consuming, which can lead to alcohol poisoning, dehydration, and alcohol-related injury or death. Next, we will define some terms associated with harm reduction and substance use that you may not know, or that you may not have a full understanding of. Let's start with the term safe consumption site. A safe consumption site, also known as a supervised consumption site, is a location where individuals are able to bring their own supply of substances and consume them under the supervision of qualified individuals. This often includes nurses, doctors, social workers, community health workers, and peer workers. These locations help reduce the harm that is associated with consuming substances alone or in unsafe environments. The staff at these locations are trained in recognizing and responding to overdoses and acute drug toxicity. Safe consumption sites also provide access to other harm reduction services, which leads me into my next term, drug checking. Drug checking is the practice of testing substances to determine what is in it. A common example is testing substances for fentanyl. Drug checking can be accomplished in a number of ways. The simplest of ways is with test strips. These test strips come in a kit and are used similarly to a home pregnancy test. A small amount of the substance is dissolved in a specific amount of water. Then you dip the test strip into the dissolved substance and the liquid travels up the strip. The strip will then display either 2 lines for a positive fentanyl result, or it will display 1 line for negative. However, these test strips do not cover all potential additives and primarily check for common or extremely harmful additives. Another method for drug checking is using a mass spectrometer, but we will explore this method more later in the episode when we talk about the local harm reduction services that are available on Vancouver Island. Another term I would like to explore is safe supply. Safe supply, or safer supply, is the term used for the provision of prescription, pharmaceutical-grade medications as a safer alternative to the toxic illegal drug supply for individuals who use substances. This process connects individuals to services such as regular appointments with a doctor or nurse practitioner, medical care, social support, mental health support, addiction services, peer support, and so much more. It's important to remember that harm reduction isn't about forcing people to stop risky behavior. It's about meeting people where they are, respecting their own personal goals for their health and well-being, and finding ways to reduce the potential harm that they may experience using methods that work for them as an individual. The last term I want to explore with you right now is naloxone. Naloxone, also called Narcan, is a medication that is used to reverse the effects of opioids in the event of an overdose. Naloxone does this by blocking the opioid receptors in the brain, which means that the opioid molecules have nowhere to bind and cause their effects, thus reducing the effects. In the event of an opioid overdose, naloxone saves lives. We will explore naloxone further later in the episode when we talk about what to do in the event that someone around you is experiencing an overdose or acute drug toxicity. So stay tuned for that and so much more. If you remember one thing from this segment, I would like it to be that harm reduction is a normal response to anything that poses the risk of harm to an individual or population. Think about this the next time you are buckling your seatbelt, or applying sunscreen, or even washing your hands. If you would like to check out any of the sources used today, or read more about the topics discussed, please check out our show notes on Facebook or Instagram at A Sound Constitution. Next up, Brianne will be diving into some of the historical context surrounding harm reduction and substance use in Canada and worldwide. So stay tuned!
Hey everyone! Now that we've talked about what harm reduction is, I want to shift into what it actually looks like in practice. A lot of people still think harm reduction is something new or experimental, but it has actually been a part of Canada's healthcare system for decades. It's supported by major health authorities like the BC Centre for Disease Control, Health Canada, and the World Health Organization. So this isn't a fringe idea, it's a well-established public health approach that has been saving lives for a really long time. When we look outside of Canada, the picture becomes even clearer. Countries that invest in strong harm reduction strategies consistently see better outcomes. They have fewer overdoses, they have lower rates of HIV and hepatitis C, and they see fewer people ending up in emergency rooms or dealing with long-term health complications. Portugal is a well-known example, but places like Switzerland, the Netherlands, and Australia have shown similar patterns. The evidence is consistent across different cultures and different healthcare systems. When people have safer options, communities stay healthier. One of the most effective tools used around the world is drug checking. It's much more common than people think. More than 40 countries use drug checking technologies at festivals, nightclubs, community centers, and outreach sites. These tools can detect fentanyl, benzodiazepines, and dozens of other substances that people don't often know are in their drugs. And when someone learns that what they have is contaminated, it often changes the decision they make. Many people will choose not to use it. Others will use less or make sure that they're not alone. But whatever the decision is, it's informed, and informed decisions save lives. Here on Vancouver Island, harm reduction has a long history. We were early leaders in several areas, but one of the biggest examples is community-based naloxone distribution. Long before naloxone became widely available at pharmacies, Island Health and local community organizations were already training people, handing out kits, and teaching basic overdose response. There were outreach workers, nurses, peers, and volunteers out there doing this work for years before the overdose crisis dominated the news. Because of that early action, naloxone kits are everywhere now. You can find them in schools, shelters, workplaces, libraries, and community centers. Teachers carry them, coaches carry them, transit staff carry them. Everyday people carry them because they want to be prepared to help. Most overdoses in Canada happen in private homes, so having naloxone available in the community really matters. Every kit represents another chance for someone to survive. Every time someone reverses an overdose, it buys time for connection, support, and treatment if the person chooses it. Nanaimo in particular has a really unique place in Canada's harm reduction history. We were one of the first cities to introduce harm reduction vending machines. These machines offered anonymous access to things like sterile supplies, sharps containers, and sometimes naloxone. There was no paperwork, no appointment, no need to talk to staff if someone didn't feel comfortable. It was low barrier and available at all hours. For many people, that kind of accessibility is what makes harm reduction possible in the first place. We'll be talking more about those vending machines in our interview later on, but the main idea is this. When communities remove barriers, people stay safer. When services are easy to access, more people use them. And when people use them, health outcomes improve for everyone. It's also important to remember that harm reduction is about much more than just supplies. It is about connection. It's about building trust with people who may not feel safe or welcome in traditional healthcare settings. For many people who use substances, harm reduction workers are the only point of contact they have with the health system. Something as simple as a nurse handing someone a naloxone kit might be the first positive and supportive interaction that a person has had in a really long time. And those small moments of safety and respect can open the door to bigger conversations about housing, employment, mental health, chronic illness, and recovery. Harm reduction does not force anyone into treatment. It simply keeps people alive long enough that treatment becomes possible. People can't access detox, mental health services, or opioid agonist therapy if they're not alive to do it. And across the world, that simple truth has shaped how public health organizations approach substance use. Here on Vancouver Island, we see it every day. Our communities are not perfect, and the overdose crisis has hit the island really hard. But we have also seen incredible leadership from people on the ground. Outreach teams, peers with lived experience, local organizations, and healthcare providers have been working together for years to build services that meet people where they're at. And even though the crisis continues, those efforts have saved thousands of lives. They have prevented infections, reduced emergency hospital visits, and supported people who might otherwise be completely isolated. Harm reduction is not a magic solution, but it's one of the most effective tools we have right now. It is realistic, it's compassionate, and it's backed by decades of strong evidence. So as we move into our next segment, we're going to look more closely at how harm reduction shows up right here in Nanaimo. We'll talk about what's working, what's changing, and what the future might look like as new strategies continue to emerge.
Thanks, Brianne. I feel like I learned a lot. Next up on the program, Sophia takes us through some local harm reduction services.
Hey everyone! So now that we understand a little bit more about harm reduction, let's talk about some of the local services in Nanaimo, on Vancouver Island, and that are available across BC. When you visit the Island Health website, they provide access to some of the harm reduction services and supports that are available locally and across the island. For example, drug checking. Drug checking services are available in Campbell River, Comox Valley, Cowichan Valley, Nanaimo, Port Alberni, Port Hardy, and Victoria. The specific locations and contact information is available on the Island Health Harm Reduction website and will be linked in our show notes from today's episode. Other drug checking services that are available include mail-in services such as the Vancouver Island Drug Checking Project. Island Health also indicates that fentanyl test strips are available at safe consumption sites and overdose prevention sites. Island Health's website also connects individuals to Toward the Heart, the BC CDC's harm reduction services. Toward the Heart outlines where to access take-home naloxone kits as well as safe consumption kits and supplies. Let's quickly define the term safe consumption supplies. Safe consumption supplies are a harm reduction tool that provides a safer alternative to consuming drugs using old, contaminated, or shared supplies. Safe consumption supplies reduce the risk of infection, bloodborne illnesses, and more. We'll talk more about naloxone and overdose response in my later segment. Another resource on the Island Health website is the Lifeguard Digital Health website and app. Lifeguard is a digital service that connects individuals directly to online services and local services of their choice. This can include mental health support, addiction services, safe consumption sites, drug checking, provincial news surrounding the toxic drug supply, and emergency services. The Lifeguard Connect app also has a feature for individuals who are consuming substances alone. The Use Alone timer allows individuals to enter their current location and the substance that they are consuming. The individual then starts the timer when they are consuming their substance. Based on the type of substance that they have entered, the time frame will be different. If the timer counts down and the individual doesn't manually stop it, such as in the event that they are experiencing an overdose, the Lifeguard app contacts local emergency services and provides them with your location and information. Now let's talk a little bit about safe consumption sites. Safe consumption sites, or overdose prevention sites, as we previously discussed, are safe locations where individuals can consume their substance under the supervision of trained staff. As previously mentioned, There are 8 communities across the island that currently have safe consumption sites. However, the services and accessibility vary greatly between these communities. For example, the hours of operation. The first thing that I noticed when looking into this factor was that the hours of operation are not listed anywhere online and are only available by calling the specific location. After I called around, I found out that several locations that are listed had invalid contact information, such as Port Alberni and Comox Valley. I also learned that all of the safe consumption sites that I spoke to are open 7 days a week, but their hours of operation varied. Cowichan Valley's safe consumption site is open from 8 a.m. till 8 p.m. Campbell River's safe consumption site is open from 9 a.m. to 7:45 p.m. Nanaimo's safe consumption site is open from 11:15 a.m. till 9 p.m. And Victoria, which has 2 locations, one of which is open from 8 a.m. till 7 p.m., and the second of which is open from 2 p.m. till 9 p.m. So this brings up the question of how accessible are these services? If an individual did not have access to a phone, they would not be able to find the hours of operation very easily. Another aspect is the times that these overdose prevention sites are open until, with 9 p.m. being the latest across the island. I wonder, are these hours realistic for when most individuals are consuming their substances and would benefit from a safe consumption site? Before we move on, I wanted to touch briefly on some of the differences in service availability. Let's take drug checking, for example. Although all the safe consumption sites across the island have drug checking services, the time frame for results varies greatly. This can be based on resources such as spectrometry technology and other testing devices. Are they on site, or does the sample need to be transported elsewhere? This can also be related to staffing for the technologists who carry out this level of drug checking. For example, Victoria has the shortest turnaround time with results available in just 20 minutes. However, the time frame for results from other sites can vary from hours to days. If you would like to learn more about the services or information presented here today, please check out our show notes on Facebook or Instagram at A Sound Constitution. Next up, we have Finley with an interview from the Harm Reduction Alliance, so stay tuned. And thank you again for listening to A Sound Constitution on CHLY 101.7 FM. Here's Finley.
Thanks so much for coming on the show. Why don't we start off with telling us a little bit about yourself? Who makes up the Harm Reduction Alliance?
My name is Sarah. I'm a 4th-year nursing student at VIU, and I'm in the Healthy U VIU Harm Reduction Practicum Community Placement Group. I've lived in Nanaimo for many, many, many years now, and I've grown up in this community. And it's been a really great way to expand my nursing practice, working in community harm reduction and seeing how we can help people not only in the hospital, but also outside of. And it's great being able to go out and be in the community with people. I love spending time outside. I love being active. I love being in my community. And this is a really great way to kind of bring all of that together and, work on becoming a nurse.
My name's Stephanie. I'm originally from Langley on the mainland, and I moved to Nanaimo a couple years ago for nursing school. So far, I've been really enjoying it here. I love being out in nature, just exploring new things. And I've been really enjoying this practicum placement so far, as it's allowed me to kind of think about nursing from a different lens and engage more in the educator and advocacy aspect of nursing.
I'm Chantal Amistad. I'm also from the mainland, from Surrey. And I'm the 3rd member of the Healthy U VIU Harm Reduction team. It's been a really great practicum placement, getting that chance to work with the community and connect with the campus on a deeper level. And it's also been a really great learning experience in terms of just community work and advocacy like the other two were saying. It just kind of flips that mindset from that hospital sense into a different type of environment, which has been really good.
Could you tell me a little bit about the VIU Harm Reduction Alliance? What work do you do and who else is involved?
So the VIU Harm Reduction Alliance is a multidisciplinary group of students and staff from VIU who care about harm reduction deeply. We believe that there is a great need for education, understanding, and action on our campus and within our community. We are informed by scientific data and guided by compassion, respect, and the lived and living experience of our peers. We are committed to actively decolonizing and seeking out the knowledge, experience, and expertise of Indigenous-led approaches that recenter harm reduction within a cultural human lens rather than a political one.
That sounds awesome. Sounds like you're doing some amazing local work and you have a really homegrown mission.
Yeah, it's definitely like a very organic group, if that makes sense.
Mm-hmm. And what work do you do? What does an average day sort of look like for you?
It kind of varies. We do a lot of planning for like different events that we have going on. In the first semester, we did a lot of like informal assessments, like trying to engage with like the VIU student population just to get an understanding of what kind of interventions they could really benefit from, like with regards to harm reduction and what kind of needs exist on the campus. During our practice meetings, we kind of talk about findings we get from like engaging with the student population, and we start brainstorming events. Examples of events that we've had in the past are hosting and organizing harm reduction information booths on different parts of campus. And this semester we incorporated naloxone training at those booths as well. We've also hosted like community building events to help like spread awareness of harm reduction and like break down stigma around substance use, where we had like craft nights happening. And this semester, our big focus has been planning a harm reduction educational panel.
That educational panel sounds very interesting. How did you decide which information the community needed more of?
Through engaging with VIU's population, we've kind of determined that there's like a lack of knowledge about harm reduction and why it's important. So we think that having this kind of like education panel will be beneficial for VIU's community as well as like the broader Nanaimo community.
What attracted you to this kind of work? Is there anything specific?
I mean, I can't speak for Chantel and Stephanie in saying this, but definitely, lived experience and living experience has drawn me into this work. As a nursing student, we're, very hush-hush about our own personal problems sometimes. And I feel like that leads to stigma as well, which is something that we as a group are, trying to break down across campus and across the community. And one of the ways that I've been trying to do that, and one of the things that attracted me to this work in the first place, was being able to use my experiences with, substance use and addiction, and taking that experience and using it to connect with people in the community and, to show them that not everyone's out to get them. There are people in the community who are going through the same things as them. There are people who may seem like they have it together when they do indeed not. And it's been really empowering to use my experiences to help other people get through their own.
Powerful.
Yeah.
That's powerful.
It's a very fluid, individualized process. There's no right or wrong way to approach it. And you can't mess it up. You can relapse and, you can fall back into those habits, but it's how you move forward that counts.
Stephanie, Chantel, either you want to jump in?
Sure. I guess for me, like this practicum group wasn't my first choice when I was like looking at the options for Nurse 314. But having gotten the chance to work in this group and do the things that we're doing, I find that like I've really been enjoying it, and I really see the need for harm reduction and like destigmatization of substance use and people who are living unhoused, as like stigma is very pervasive, and it can really have like a negative effect on like the health outcomes of people who are stigmatized. So I feel like this practicum experience has been really like eye-opening in that way.
Yeah, kind of adding on to what Stephanie was saying. Personally, I grew up in Surrey, so substance use and people experiencing homelessness is not really new to me, but I grew up with that idea that was kind of instilled that, oh, that really stigmatized perspective that people usually put on to their children, I want to say. So kind of getting into this practicum group and learning more about harm reduction and working with people that have that lived experience has kind of been really eye-opening, and just kind of relearning all of these things that I grew up just kind of put onto me, I want to say. So this practicum group has been really good in just kind of eye-opening and seeing things from a different perspective, which I think a lot of people need to be able to see.
You have some amazing motivations. So, what part of this placement has been the most challenging?
Um, in terms of the most challenging, I think we could say it's definitely been like finding ways to effectively engage with the student body and like just overall VIU population and getting our information out there. Nowadays a lot of things are very social media based. Everyone is online, everyone's looking at their phones. And even when they're looking at their phones, they're not necessarily looking in the spots you want them to look. So we've found it really difficult to, just get our information out there, get ourselves out there, and get people, knowing about who we are. And also kind of just creating spaces that feel welcoming for students as well. Harm reduction can be a really, really intimidating topic for some people, which is completely understandable because there's a lot to unpack behind it. But just trying to create spaces where students feel safe and open to have these conversations without any stigma, or judgment.
It's awesome. You're really opening up the floor for dialogue. It's something we really need more of.
Yeah, we're definitely trying to just, have conversations with students and see what their thoughts are. At our harm reduction information tables this semester, we started doing basically a spinny wheel, and we just had a couple questions on it related to harm reduction about like initiatives they've seen on campus or things they'd like to see more of in regards to harm reduction on campus. And we did it. We said if you span the wheel and answered a question, you could get some candy. And it was a really good engagement point at our tables. A lot of people were willing to spin the wheel to get some candy. And we had some really good casual conversations that did give us quite a lot of insight as to some of the gaps in knowledge that were, on campus.
And could you speak to some of those gaps in knowledge? Is there anything that you've noticed that the community is really lacking?
In terms of the VIU community, I think we just noted a lot of general misunderstanding or general lack of knowledge. We had quite a few people ask us what naloxone was, quite a few people asking for, the definition of harm reduction, all of which is extremely important information, and we were, more than happy to provide it to people. But these are terms, these are things that people need to know. In order for us to create change throughout the community, people need to be aware and people need to know these things. Just seeing that there was such a great population of students that really, really don't know anything, and trying to think of ways that we can bring more knowledge to the community at VIU as a whole for both faculty and students.
Adding on to what Sarah was saying, a lot of the time when people would approach our tables, there was also a lack of knowledge in terms of just where to get resources on campus in general. We led a lot of people to the Health and Wellness Center, where people weren't sure where that was or what they really did. So it was a lot of telling people like, oh yeah, you could get resources here, you could get naloxone there, as well as a whole bunch of other education pamphlets and resources and all these other things. So there's just like general knowledge gap, I want to say, on campus in terms of just harm reduction practices in general.
And in starting to address all these gaps, where would we start?
So yeah, we're very much brainstorming. A student body can't do much institutionally, but we have thoughts, we have ideas. I think one of the things that we've touched on the most is implementing just mandatory naloxone training throughout campus for students. Maybe trying to make it, something that happens in first year across all faculty departments. set naloxone training dates for faculty and students at the beginning of the semester. We also briefly discussed making it something that could show up on students' co-curricular records after completion, similarly to our violence prevention training, which was a mandatory part of our schooling. So that would be a nice way not only to raise awareness and, get more knowledge spread to students, but also give them an opportunity to, have that proof of knowledge that they can showcase, throughout the rest of their life on their co-curricular record.
I think that's phenomenal. Really incentivize those life-saving skills. And in your placement, what resources have you seen that have been useful in the community?
I could answer that one. Resources that have been useful in the community, I want to say just within our campus, what we've seen is I want to say our harm reduction tables have been really useful. For some people, it's been the only resource they've really seen on campus of harm reduction. So having that access to just education and naloxone, as well as training, and just being able to engage in conversation with other students has been really useful for people. And we've gotten a lot of engagement through those. We've actually taken stats at all our tables, and with each table, we've had around 20 plus students coming and talking to us, asking us questions, getting supplies, even if all they're doing is taking a snack from us. That's kind of engaging with the topic in general. They ask what we're doing, and they leave with a snack and a bit more knowledge.
Absolutely. And it's all a piece of harm reduction, right? Just engaging with the community, getting them to come and talk and engage with those services.
There's actually another community resource that's kind of cool too, and I might misname it, but I believe it's called the Primary Care Outreach Van, and it's something that I'm pretty sure is run by Island Health. But basically, it's just a van that goes to different spots in like central Vancouver Island, Nanaimo, Parksville, I believe some spots up in Duncan and Courtney, or down in Duncan, Courtney. And they have their little van. Sometimes there's a doctor there, some nurses, outreach workers, like social workers, and people of the unhoused population can come up and they can get dressing changes, assessments. Sometimes the doctors will be able to write them prescriptions. I saw that when I did a kind of ride along with them. And it was a really great opportunity for people to, be met where they're at and be met in their community, in their homes, if you will. And they could come, they could get food, they could get clothes if they were available, they could get health care, social resources, they could meet with social workers to get help with any paperwork they needed. And I thought that that was a really great way to kind of provide resources within the community by going to them instead of having them come to us, because I feel like that takes away, some of the barrier sometimes.
Yeah, I wholeheartedly agree. We need to increase access to these services inside the community instead of having people come to them. While we're on the topic of accessible harm reduction services, I heard there was a harm reduction vending machine pilot project that was ran in Nanaimo. Could you tell me a little bit more about that?
Basically, the vending machine was meant to be like a really useful, accessible 24/7 way for people to get life-saving care, life-saving harm reduction supplies. They could get naloxone, they could get safe injection kits, safe sex supplies, drug testing kits, a whole bunch of things that you can't always find on the streets. And it was in one central hub at the hospital as well. So, if someone needs care, they're kind of already there, which is helpful. It was meant to be an anonymous service so that people felt less judgment going into it. And basically, in summary, the program was shut down due to political interests and public controversy. A BC Conservative Party candidate posted videos on social media highlighting their personal concerns regarding the issue, and discussing, their family history regarding addiction. And one of the quotes from the news article is that her concern was, now you have absolutely no person you're connecting with. It's just here. Take the paraphernalia and just go do your thing. So her concern, which kind of sparked the whole situation towards getting it shut down, was that people were coming to get supplies, but they weren't connecting with the community or connecting with, community outreach members who could help them and help further direct them towards resources that could lead them, in the direction of recovery.
It sounds like it may have been a removal with good intentions, but removing services without providing any alternative services, that just leaves the community with gaps.
Yeah, it could have been gone about in a better way, and better resources could have been provided for removing another one.
And if people were interested in engaging with the community and getting engaged and maybe doing some harm reduction work, do you have any recommendations or resources they could reach out to?
Well, of course, the VIU HRA is always open to students and faculty who are interested in joining, who are interested in learning more about harm reduction or participating more in the things that we're doing within the VIU community. We do have an Instagram page, and it's just at VIU_HRA. And when people go to that Instagram page, they can see posts about our events, general information about harm reduction. And there's also a couple links on the website as well to our Harm Reduction Alliance website and the link tree with a couple other social media resources. But the VIU Harm Reduction Alliance website is basically a big resource hub that people can access. Not only does it have information about the VIU HRA, Healthy U VIU, and like upcoming events, but it just discusses what harm reduction is in general, the toxic drug crisis in British Columbia and Nanaimo, what naloxone is, how to use it, where to access it in Nanaimo, VIU, and the community, and then just a whole bunch of campus and community resources compacted and sorted so that they're easier to look through for people on the website.
Phenomenal.
Yeah.
Sounds like you have a whole list of resources.
Yeah, it's broken down. The community resources is broken down into Nanaimo, Island, provincial, and federal resources. So it makes it a bit easier for people to kind of find what they're looking for and access what they need.
Do you have any final shout outs, call outs, calls to action, anything you'd like to speak on?
I don't know if Chantel and Stephanie have any last words, but I think I can speak for all of us when we say that Sarah Lovegrove has been an instrumental part in all of our work. Not only is she a fantastic nursing instructor, but she is a fantastic human being. And without her, a lot of what we've been doing would not have been possible. And then, of course, our instructor, Maureen O'Connor, has been another incredible part of all of this work. And she's been so supportive and helpful. And, we're just so excited to continue doing what we've been doing.
That was my interview with Stephanie, Chantel, and Sarah from VIU's Harm Reduction Alliance. If you're interested in knowing more about anything we talked about during this interview, check out our show notes. I'll have links to everything posted there. Next up, Brianne's going to take us through why harm reduction matters, some of the factors that contribute to substance use, and so much more, right here on 101.7 CHLY.
Thanks, Finley. It's really great to hear from people who are doing this work every day, and your conversation with the Harm Reduction Alliance really highlights how much heart and dedication goes into supporting our community. I just want to build on what they said and talk a little bit more about why harm reduction matters and why it continues to be an essential part of public health on Vancouver Island and across Canada. A good place to start is with the myths. One of the most common myths is that harm reduction somehow enables or encourages substance use. That idea shows up a lot in conversations, especially when people are feeling worried or frustrated about the overdose crisis. But when we look at the evidence, that fear just does not hold up. Research from BC CDC and other international studies consistently shows that harm reduction does not increase drug use and instead reduces deaths, infections, and emergency hospital visits. Another reason harm reduction matters is because substance use does not happen in a vacuum. It is shaped by things like poverty, housing insecurity, trauma, racism, disability, chronic pain, and mental health challenges. When people do not have stable housing or access to primary care, their health gets worse. When people face discrimination in healthcare settings, they're less likely to seek help. And when basic needs are not met, substance use often becomes a way to cope. These are not individual failures. They are social conditions that increase risk in some communities more than others. This is why harm reduction is also an issue of equity. Indigenous people in BC, for example, are disproportionately affected by the toxic drug crisis, not because they use substances more often, but because of the impacts of colonization, intergenerational trauma, systemic racism, and unequal access to care. The same is true for people who are unhoused, people living in chronic poverty, and people who have survived violence or unstable family environments. If we want to effectively address substance use, we have to understand the conditions that surround it. And that brings us to judgment-free care. For many people who use substances, the biggest barrier is not the substance itself, it's stigma. People are afraid of being judged or punished. They're afraid their children will be taken away. They're afraid of being turned away from care or treated poorly. But when care is offered without judgment, people are more likely to seek help. They're more likely to return. And they're more likely to build trust with healthcare providers. Judgment-free spaces are not just kind and caring. They actually save people's lives. Another thing that we don't talk about enough is that accessible harm reduction also makes financial sense. When people have access to sterile supplies, we prevent infections like HIV and hepatitis C, which are extremely expensive to treat. When naloxone is widely available, we prevent emergency hospitalizations and ICU stays. When drug checking and supervised consumption sites prevent overdoses, we save millions in healthcare costs every year. Harm reduction is not only compassionate, it's cost-effective, and it reduces strain on emergency departments that are already stretched way too thin. At the end of the day, harm reduction matters because it keeps people alive. It reduces suffering and it creates safer, healthier communities. It treats people with dignity no matter their circumstance. And as we continue today's episode, we really hope that listeners walk away understanding that harm reduction is not about encouraging substance use. It's about recognizing humanity, offering safety, and making sure people have the chance to survive and heal.
Thanks, Brianne. Understanding why harm reduction matters gives us the bigger picture, but it also brings us to the most urgent question of all. What do we do when someone is in danger? These issues aren't abstract. Overdoses happen every day in our community, and knowing how to respond can save a life. So now, let's move from the why to the how, with Sophia, as they talk about what to do if you think someone is experiencing an overdose, and how to stay safe when using substances.
Hello again. We've covered a lot of important information so far. But what do you need to do if you think someone around you may be experiencing an overdose? How can you help keep yourself safe if you are consuming substances? Let's talk about it. First, let's talk about something that we've touched on a lot today, naloxone. We've already covered what naloxone is and how it works, but how is it used? Who can use it? And when is it necessary? Where can you get it? Naloxone is available in a few different forms. Most commonly in BC, it comes in an injectable form, but it is also available in an inhaled form that is administered through the nose. In BC, take-home naloxone kits are available free of charge to anyone who may be at risk of experiencing an overdose, or to anyone who may be exposed to someone experiencing an overdose. There are many locations where naloxone kits can be obtained, the easiest of which is at any pharmacy. If your naloxone kit expires, you can also exchange it for a new one at pharmacies. Training for how to administer naloxone is available online at towardtheheart.com. This course goes into how to identify the signs and symptoms of an opioid overdose, as well as how to use naloxone and how to provide support until emergency services arrive. But let's do a brief overview of some of the signs and symptoms right now. Toward the Heart identifies key signs of an opioid overdose as slow or no breathing, the person is sleepy, difficult to wake up, or less responsive. To count for slow or no breathing, less than 1 breath every 5 seconds, or less than 12 breaths per minute. The following signs might also be observed. Lips or fingernails appear gray or ashen in darker skin tones, and blue or purple in lighter skin tones. Breath sounds that are unusual or snoring, gurgling, choking type sounds. Another sign is tiny pupils. An important note from Toward the Heart is that if you are unsure if the person is experiencing an opioid overdose, and think that they may be experiencing an overdose from a different substance, that naloxone administration will not cause any additional harm. So it is better to be safe than sorry. Now let's talk about what to do in the event that someone around you is experiencing an opioid overdose. The first thing you should do is call 911. Next, determine if it is safe for you to provide assistance. If you do not feel safe, the best thing that you can do is stay on the phone with 911 until emergency services arrive. If you do feel safe providing help, you can use the Save Me acronym to remember the steps for responding to an opioid overdose. First step is stimulate. This means seeing if the person is responsive, meaning awake and alert. Tell the person who you are and that you are here to help them. Ask them their name. If they do not respond, you can try to stimulate them by shaking their shoulder and continuing to speak to them. The next step is airway. Check to see if the person is breathing and if their mouth and airway are clear. If there is something in their mouth or blocking their airway, and you feel comfortable doing so, use a gloved hand and remove it gently if you're able to. The next step is ventilation. This involves providing rescue breaths. If the person has less than 12 breaths per minute, you can provide rescue breaths using a CPR mask or face shield. Providing 1 breath every 5 seconds, ensuring that you see the chest rise with each breath. You should only attempt this if you feel comfortable and have the appropriate experience and tools available. If the person is breathing normally on their own, but is not responsive, or if you have to leave them alone for any reason, such as to go and get a naloxone kit, you should put them into the recovery position. This involves rolling them onto their side, extending the arm that is underneath them straight out in front of them and under their head to support it. With the leg that is on top, bend the knee and bring it forward in front of them. This prevents them from rolling onto their stomach. The next step of the Save Me acronym is evaluate. This involves rechecking if they are responsive or if they have started breathing normally on their own. The next step is medication. This involves administering naloxone if it is available. As previously mentioned, naloxone kits are available at pharmacies free of charge, and many businesses and establishments will keep a kit on site in the event of an emergency. A good tip is to look for businesses that have an AED sign on their door or window. Oftentimes, they will also have naloxone and other emergency supplies on site. Naloxone can be given every 3 minutes until the person becomes more responsive or until emergency services arrive. You can learn how to administer naloxone by completing the online course at towardstheheart.com. The final step in the Save Me acronym is evaluate and support. This involves reevaluating frequently if the individual's breathing or responsiveness has changed. It also involves continuing to provide support, such as rescue breaths and naloxone administration as per the outlined timeframes. Make sure you stay on the phone with 911 and continue to evaluate and support until emergency services arrive. So sometimes people are afraid to call 911 because they are worried about the legal repercussions, such as having illicit substances. The Good Samaritan Act is a law in place in Canada that protects the caller and anyone at the site when emergency services arrive from charges such as possession. Lastly, I would like to cover some information that will help individuals stay safe when consuming substances. First is to never consume alone. Have a friend or loved one nearby. Go to an overdose prevention site, or even utilize services such as the Lifeguard Connect app. Second is to check your substances. As previously mentioned, there are free anonymous services across the island and remotely that will complete a drug check for you to ensure you know what you are consuming. You can also receive take-home fentanyl test strips. Finally, carrying naloxone. Having a naloxone kit in your home, your vehicle, or on your person is an easy way to be prepared in the event that you or someone around you experiences an overdose. Thank you for taking the time to listen and learn. We would just like to remind you that the information shared here today is for educational purposes only. This information should not replace the information from your primary care provider, regional health authority, or the BC CDC.
And that brings us to the end of today's episode. Today, we took a look at the heart of what harm reduction really means for our community. We started by breaking down the key concepts: safe consumption sites, safe supply, naloxone, and drug checking, and explored how harm reduction has been used for decades across Canada and around the world. We looked at the services available here in Nanaimo, the barriers people still face, and why equitable access is essential. We also heard directly from the Harm Reduction Alliance, whose work on the ground shows the compassion, dedication, and human strength behind these services. We unpacked myths, discussed the role of stigma, and highlighted how harm reduction saves lives, supports equity, and reduces strain on our healthcare system. Finally, we walked through what to do in an overdose, how to use naloxone, and practical steps to keep yourself and others safe. For details and show notes from today's episode, or to follow along on what's coming up this season, check out our Facebook page, A Sound Constitution, and our Instagram at CHLY A Sound Constitution. If you missed parts of this episode, or would like to listen to this episode, or episodes from our past shows, check out our YouTube at A Sound Constitution, or our Spotify at A Sound Constitution. Otherwise, we'll see you all next week.